Let's talk about the median nerve. The median nerve is the main nerve of the front of the forearm. Its root value is C5 to T1. It controls the coarse movements of the hand and also called as the labrador's nerve. It also supplies the thenar, the skin over the thenar eminence. So, talking about its course of the median nerve, in the arm, the median nerve is related to the brachial artery. It lies in the arm. It lies lateral to the brachial artery. In the middle of the arm, it crosses the brachial artery from lateral to the medial side and continues to be on its medial side till the elbow joint. At the cubital fossa, it lies medial to the brachial artery and is most medial content in the cubital fossa. It later enters in the forearm and lies between the flexor digitorum superficialis and flexor digitorum profundus. At the wrist, it reaches down to the region of the wrist and lies deep and lateral to the palmaris longus tendon, passes deep to the flexor retinaculum through the carpal tunnel, and enters the palm by terminating and dividing into muscular branch and the cutaneous branch. So we'll just revise the course. The median nerve is the main nerve of the front of the forearm. It also supplies the muscles of the thenar eminence. It controls the coarse movement of the hand, also called as the labrador's nerve. The root value is C5 to T1. Talking about the course, the median nerve is related to the brachial artery in the arm. In the arm, it lies to the lateral side of the brachial artery, and in the middle of the arm, it crosses the brachial artery from lateral to the medial side and remains to the medial side till the elbow joint. In the cubital fossa, it is the most median structure. In the forearm, the median nerve enters the forearm and lies between the flexor digitorum superficialis and flexor digitorum profundus. At the wrist, it reaches down the region of the wrist and lies deep and lateral to the palmaris longus tendon. It passes deep to the flexor retinaculum through the carpal tunnel, enters the palm, and terminates by dividing into muscular and cutaneous branch. Talking about the relations of the median nerve, in the cubital fossa, it lies medial to the brachial artery, in front of the brachialis and behind the bicipital aponeurosis. In the forearm, it enters by passing between the two heads of the pronator teres. Here it crosses the ulnar artery, which is separated by the deep head of pronator teres. Along the ulnar artery, it passes beneath the fibrous arch of the flexor digitorum superficialis, run deep to the muscle on the surface of the flexor digitorum profundus, and is accompanied by the median artery, a branch of the anterior interosseous artery. 5 cm above the flexor retinaculum, that is at the wrist, it becomes superficial and lies between the tendons of the flexor carpi radialis laterally and flexor digitorum superficial medially. It is overlapped by the tendon of the palmaris longus. Median nerve enters the palm, passing through the flexor retinaculum deep through the carpal tunnel. So let's revise this. Talking about the relations, in the cubital fossa, it lies medial to the brachial artery, in front of the brachialis and behind the bicipital aponeurosis. In the forearm, it enters by passing between the two heads of the pronator teres. Yet it crosses the ulnar artery, which is separated by the deep head of the pronator teres. Along with the ulnar artery, it passes beneath the fibrous arch of the flexor digitorum superficialis, runs deep to this muscle on the surface of the flexor digitorum profundus. It is also accompanied by the median artery, a branch of the anterior interosseous artery. 5 cm above the flexor retinaculum, that is at the wrist, it becomes superficial and lies between the tendons of the flexor carpi radialis and flexor digitorum superficialis. Flexor carpi radialis laterally and medially at the flexor digitorum superficialis. It is overlapped by the palmaris longus, and median nerve enters the palm, passing the flexor retinaculum through the carpal tunnel. Talking about the branches of the median nerve, the articular branches is given at the elbow joint and the proximal radioulnar joint. The muscular branch at the cubital fossa supplies the flexor digitorum superficialis, flexor carpi radialis, and the palmaris longus. So, flexor carpi radialis, palmaris longus, and the flexor digitorum superficialis. The anterior interosseous nerve. Here it is the anterior interosseous nerve. It supplies the upper part of the forearm and supplies the flexor. It is in the upper part of the forearm. It supplies the flexor pollicis longus. Here is the flexor pollicis longus, and in the lateral half of the flexor digitorum profundus and the pronator quadratus. The palmar cutaneous branch arises at the short distance. The palmar cutaneous branch arises at the short distance above the flexor retinaculum and supplies the skin of the thenar eminence. The vascular branch supplies the radial and ulnar artery, and a communicating branch is given to the ulnar nerve. So let's revise. Talking about the branches. The articular branch is given at the elbow joint and proximal radio-ulnar joint. The muscular branch at the cubital fossa supplies the flexor digitorum superficialis, flexor carpi radialis, and palmaris longus. The anterior interosseous branch at the upper part of the forearm supplies the flexor pollicis longus and the lateral half of the flexor digitorum profundus and the pronator quadratus. The palmar cutaneous branch arises at a short distance above the flexor retinaculum and supplies the skin over the thenar eminence. The vascular branch supplies the radial and ulnar artery, and a communicating branch is given to the ulnar nerve.